Hi, welcome to Agape Dentistry. How are you doing? Good, good. So we are going to go over a comprehensive exam. So what that means is we're going to check your muscles on your face, check your lymph nodes, check out all around the inside of your mouth, and then as well as your teeth. That's generally a telltale sign. It helps us find if you're going to have, abnormalities. So, early signs of, cancer, if we can, detect that, as well as on top of, see if there's any issues with drainage, things like that. And then also as well as teeth, if there's any decay or anything like that. Do you have any questions so far? No? Okay. All right, so let's go over your medical history. So I'm reading down through, so you don't have anything like diabetes or anything like that? No? Okay. You have a family history of GERD. Are you being monitored for that? Do you know the signs for that? Okay. And the reason we, like to keep on top of things like that is because GERD, is acid reflux. So as that comes up your throat, it can also affect the health of your teeth. The extra acidity would wear away on the enamel. So if you were to ever get GERD or the symptoms, just let us know, and then we can, stay on top of that. There is a note in here that you do grind your teeth. Okay. Do you do it at night while you're sleeping? You do. Okay. Do you notice yourself doing it during the day? Not as much? Okay. Again, that's something that we'll look at, because it wears away at the top of your teeth, so it, makes it more difficult chewing our food, just the normal everyday things, but also, again, it wears away, and so we'll just want to make sure we keep track of that, as well as, the insides of your cheek, that can become tender. It can also create infections if you, bite through it. So, that's just something that we'll follow along as well. Okay. All right. So as well as your teeth health, how often do you brush your teeth? One time a day? Okay. Well, generally we suggest 2 times a day. Definitely right before you go to bed. That way, food and everything isn't sitting inside of your mouth. And then, another time, either whenever you first get up or after you have breakfast. As long as you can just do 1 a day, I really hope to have you strive to do at least 2 times a day. Okay. And then how often are you flossing? Okay. Only when you have food in your mouth. Okay. Again, that's one of those things where, food gets stuck in there and then it just wears away the teeth and could cause, more damage. So again, ideally, we would like for you to floss your teeth at night. So you floss your teeth and then you brush your teeth and it gets it all away. If you could start every other night just to get into a routine of some sort. Okay. All right. So from here, what we're going to do is the extraoral exam. So like I said, that is where we're going to go, across your face, check out, the muscles and the lymph nodes to see if we find any abnormalities. And, and it's something that we like to check. We had a patient who, that's how, we found out her thyroid was enlarged. So with your permission, I'm going to go ahead and start that. Okay. Alright, so all those forehead seems fine. Okay, and now I'm going to come around to your jaw. I'm going to go down your throat. Again, I'm just looking for your swollen lymph nodes. I don't see any, and I'm just going to go across your décolleté because your lymph nodes come down into there. Okay, now I'm going to go on your sinuses. Have you had a sinus infection lately, or a cold or anything? You did have a cold? Okay. I can definitely feel, it's, a little swollen right there. Nothing too concerning. Alright, I'm going to go on your temple. Okay. Alright, so all of that feels good. So, let's see. I'm going to go, can you swallow for me? Okay. That feels good. So what I'm going to do now is I'm going to check your cheek muscles, especially since you've been, grinding your teeth. Right? Okay, so now I'm going to check your TMJ, and I just need you to clench and then open wide. Okay, clench, open wide, clench, and open wide. Okay. Alright, now I don't see anything there. There's no clicking or anything that would show signs of TMJ. Your mouth is opening just fine, so that jaw function is good. And then as well as your muscles on your face, your tube muscles. That's fine. Alright, so what I'm going to check now is your lips. Do you work outside at all? Okay. Generally we like to check, just for skin cancer around the mouth. That all looks fine. Alright, so that's it for the extraoral exam. So now we're going to move on into the intraoral exam. So I am just going to have you recline your chair and then we'll go. Okay. Alright, and we'll start reclining your chair. Okay, and how is that? My mask put on. Alright. So, again, we're going to check the inside of your mouth now. So, we're going to look for any lumps or bumps. Feel around. And I don't see any. I also have my assistant, Suzanne, with me. So, get this reset. That way we can actually see a little bit better. Okay. Now, so I'm going to be calling out information to her, as well as things that we need to look out for in the future for you. Okay? Alright, so alright, we're going to open up your mouth. So I'm going to look at the cheek, which is what we call the buccal mucosis. And I definitely see lesions from you grinding your teeth. Susan, if you want to put bilateral lesions on the buccal mucosis. Okay, now I'm just going to feel around the roof of your mouth. Okay, that all feels fine. The bone structure feels good. Okay, and then we're also going to look at your the floor of your mouth. So I'm just going to palpate, check the lining. Okay, can you lift your tongue up? Thank you. Perfect. Okay. I don't feel any lumps. The coloring looks good. Okay. What I'm going to do now is check your tongue. The sides of it to see if there's any lesions there, if there's any sign of cancer as well. Okay. Oh, there we go. Alright, so I just need you to stick your tongue out for me. Okay. Alright. The right side looks healthy, no lesions. And the left side as well looks healthy and no lesions. Perfect. Okay. Now open your mouth and say ah. Alright. Your tonsils look a little enlarged, but again, that goes along with you saying you did have a sinus infection. The coloring of the back of the mouth looks good. Alright. Now, let's see. I need to check the articulation. So just open up, and all of that is just the bite. Okay, so bite down. Alright, so that side looks good. Do the other side. Okay, bite down again. Okay, perfect. Alright. Both of those sides look good. See, we're just flying through it. Okay, so we're going to do the periodontal exam now. So what that is I'm going to look at your gums and how they are with your teeth to see if there's any sort of disease like gingivitis. Okay? Alright. Now I'm just going to feel. Open your mouth wide. Perfect. Alright. Now that it's okay. I don't feel any abnormalities there. Okay, so what I'm going to do now is I'm going to be calling out a few numbers to Suzanne. And they're going to be a range of 1 to 3, well, 1 to 5. So we'll see where we are. Suzanne, we are going to start with tooth number 1. Okay, so we've got 3, 2, 1, 2, 2, 1, 2, 1, 1, 3, 2, 1, 4, 2, 1, 3, 2, 1, 1, 1, 1, 1, 2, 1, 1, 1, 2, 1, 2, 2, 1, 3, 2, 1, 3, 3, 1, 2, 1, 1, 1, 1, 1, 1, 2, 1. God, 2, 2, 2. Okay. Are you good? Okay, now that was just the top teeth. And now we're going to go work this side on your bottom. Okay? Are you doing okay? Okay, now we've got 111, 231, 331, 332, 331, 111, 121, 131, 141, 111, 221. Okay. Okay. So, like I said, generally that's a number range from 1 to 5. We're not really concerned with numbers that are under 3. Now, you had 2 teeth where we have a number that's a 4. So that's signs that there's little pockets in your gum that gingivitis can go. So we'll keep an eye on that, and then we'll clean it all out during the cleaning when we get to that. Again, mouthwash, brushing your teeth, flossing really goes a long way with helping that. Yeah? Okay. Okay, so next we're going to check your teeth mobility. And we don't want them to be mobile. Alright, again, Suzanne, we're going to start with tooth number 1. Okay. 1, 2, 3, 4 non-mobile. 5, 6, 7, 8 are non-mobile. 9, 10, 11, 12 non-mobile. 13, 14, 15 non-mobile. Get down on the bottom. Okay, and all of the teeth on the bottom are non-mobile. Okay, so from here, I apologize, my nose just started running. Okay, so from here we're going to do the inspection of your teeth, okay? Alright, are you doing okay so far? Well, you know what? Let me get some chapstick on your teeth, on your lips. Yeah, everybody gets some chapstick, and then you'll get to take this home. Okay. Okay, so, alright. 1 is present in sound. 2 and 3 are present in sound. 4, there is decay on the buccal surface. 5, 6, 7, present in sound. 8, there is decay on the lingual surface. 9, 10, 11, 12 are present in sound. Okay, open your mouth a little bit wider for me, please. 11, 12, 13, and 14 are present in sound. 15 is present in sound. Alright, and 16 is missing. 17 is present in sound, and 18 is present in sound. Okay, are you doing alright? Perfect. Okay, so 19, 20, 21, present and sound. 22 is present and sound. 23, there is decay on the incisal surface. 24, 25, 26 is present and sound. 27, 28, 29, present and sound. 30, 31, present and sound, and 32 is missing. Okay. Alright, so, again, you have 2 or 3 teeth that, we're going to have to schedule you to come back to get a filling in. And you have cavities starting in there. Again, it's something that we can take care of. Not too concerning at the moment. Okay? Perfect. Alright, so right now we are going to go into the teeth cleaning. So I'm going to get the trait. Just tuck that in. And then clip this around the back. Alright, perfect. Alright, so I am going to use a special sonic tool that we have to get the calcaeus off. You have a few teeth that I noticed. There's a calcaeus bridge. So it's just this little tool, nothing to be afraid of. It's going to help me get it out with the help of water. Okay. Alright, you ready? Perfect. Open up wide. Alright, now we're just going to shoot a little bit of water in there to help loosen it up. You doing this so far? Okay. Perfect. Okay, and suction all of that up. Okay, open and close your mouth. All right. Now I am going to go in and do a manual descaling just to get some of the parts that I may have missed. Okay? Are you doing all right so far? Perfect. Okay. bit wider for me. Perfect. Doing a good job. Okay. Need a little break? Yeah. Okay. You're doing good. We just need to scrape up the bottom a little bit. Do you need any more chapstick? You do? Okay. No problem. Good. Okay. Alright, so let's go in. Open. Open about halfway for me. Perfect. Thank you. Still done. Okay. Okay. Alright, we'll give you a little rinse again. Okay, open up. Alright. And we'll section all of that out. Open up. Close. Alright. Alrighty, now let's see. We're going to go in with our polish. Let's set on my tool. And so this polish is going to help just get stains and everything off your teeth. You know, the part that we like the most. Yeah. Okay, are you ready? Perfect, okay. Okay, open about halfway for me. Perfect. Okay. Now you're going to go into our best friend, the flosser. Okay. Okay, open up for me. that wasn't too terrible, was it? Yeah. Alright. Get this all fixed. Okay, so now we're going to go in with fluoride. A lot of people, it gets a bad rap. Some people think it's not needed, but you know, we found that it does help with the strength of your bones, your teeth bones. So we had this old one that we could just brush it on, but then you have to kind of wait a few minutes. So we have this one where we stick it in a tray, and we have a blue light that will cure it. So it'll only take about half the time. You don't have to sit there while we paint each tooth. Okay. Alright. Now, can you open up for me? Alright. Not too terrible. And like I said, you know, we have 3 teeth that we need to do a cavity. You have cavities, and so we need to do a filling. Again, it's been a long day. Okay, all done. Okay, so Suzanne, can you get him scheduled? Are you okay with doing this within the week? Okay, within the week to get these cavities filled. Okay, thank you. All right, well, you are all done, so it was a pleasure meeting you today, and we'll see you again next week. Perfect. Okay, do you have any questions for me in the meantime? You know, with that fluoride, just don't eat or drink anything for 30 minutes, and just let it work, and after that you can eat or drink, but don't rinse it out between then. Okay? Alright, we'll see you next week, and I hope you have a good rest of your day. Bye.